Welcome back to the Arizona Daily Mix. We ran outside because this is where all the problems are, by trees, by bushes and everything. Dr. Wendt is here with us because we're talking allergy season. How do allergies come about? What does it?
It's the immune system overreacting to things that it shouldn't be.
Yeah, and so is that from our diets, our workouts, or anything like that, or how can we help fight that?
You know, there may be some correlation, but pollen is so small it can get into our target organs much easier.
Do we sometimes need to go over, how can I say this? Over-the-counter medicine, since how can we say, step to like seeing our doctors?
Right, so I recommend that people try and avoid, so close the doors and windows, let the air conditioning and heat do the work for you, use an air purifier, rinse your target organs, remove your clothes, your shoes when you come in the house, take a shower before you go to bed, rinse off your pets or wipe them down with a baby wipe so they're not tracking pollen all over the place. And then if that doesn't work and the over-the-counter medications don't work, see an allergist.
And so when they see, what do you do with them?
Well, we typically try and assess their season so they know when to avoid and what to avoid and assess whether they're allergic or not. Today is a big pollution day, so it is not only affecting people who are allergic, it's affecting people who have issues with breathing and COPD and asthma as well. So to differentiate between the two, because people might be taking allergy medication for no reason, make sure they're using everything they should be using and there's no room for change, and then consideration of allergy shots.
So, allergy shots. Okay, so how do the allergy shots work?
They actually, it's a bit of the hair of the dog that bit you philosophy,
yeah.
But it happens to work. So basically by recurring, by frequent and repetitive small exposure, the immune system begins to realize that it's not a threat and calms down and switches over to a non-allergic way of responding to the things that we typically over-respond to.
Okay, so I know a lot of people are worried, do I have allergies or do I have COVID? And that's a big thing you go through. So how can you tell the difference there and for that?
Right, that's a good question because COVID seems to go on too. But I would say if you have breathing issues, if you have a cough that doesn't go away, you probably, or if your pulse ox, everyone has a pulse ox nowadays that checks how you're oxygenating, that's a really good reason to be evaluated for COVID. But if it's seasonal, if you were sick this time last year and it went on and then something like an antihistamine helped, maybe not perfectly, but definitely helped, it's worth considering allergies.
So, I know everyone loves these beautiful trees in their yards and everything. Is that something they maybe stop doing? Is actually maybe it's time to get these out of your yard, or is that not really going to help because it's all over the neighborhoods?
It's all over the neighborhood. A good pollen season, a great pollinating plant will spread its pollen 5 miles all around. So we'd be doing a lot of chopping down trees and plants.
So, okay, what about taking aspirin for the headache or anything? Is that really helping, or should it be an allergy kind of medicine or something?
Well, probably the combination of the two. Some people have such bad sinus pressure that an anti-inflammatory or Tylenol plus an antihistamine is more helpful. And again, addressing the allergies is going to be more definitive. Some people, it gets so bad that it starts a secondary bacterial infection and they probably need to be on antibiotics. And again, that's another reason to see a physician or an allergist.
Okay, and then help us who have those friends who are, complaining about their allergies. What can we do? Do you have any tips for us? How can we support them?
I know a good allergist. And now you do too.
And I do too. So I'm going to tell them, stop complaining, go see Dr. Wendt so they can get that taken care of.
And I'm happy to see them.
That's great, doctor. That's so important. All right, so let's make sure everyone understands. Give a really quick 2 tips right now. If someone at home is starting to feel, of course, that allergy head about to burst and everything. What can they do right now?
Avoidance, treat, see an allergist.
That's it right there. So I like it. Tell them where they can find more about you, doctor.
So relieveallergyaz.com.
There you go. Doctor, thank you very much.
Oh, you're welcome.
Good. All right, there we go. Got the allergy cure for you at home and also for Kelly here, still our producer. So, all right, come on back.